everyone. Thank you for joining us today. We appreciate your patience as we were allowing a few more registrants to jump on. We have hit record already, just so you're aware. This event will be recorded so that it can be shared for future educational opportunities. We appreciate you taking the time, and we welcome you to the Dignity Health Doc Talk on COVID and stroke with Dr. Rahul Shah. Those of you who RSVP'd early might notice that we have made an adjustment to the presenter. We initially planned on discussing today's topic with Dr. Vidu, an epileptologist. However, due to a change in his schedule, we have instead reached out to and obtained confirmation from Dr. Rahul Shah, as he has graciously agreed at the last minute to join us. He is a valid member of our neurosciences team, so I'm sure you will enjoy what he has to share with you today. Before we get started, just wanted to make you aware of an upcoming educational opportunity featuring Dr. Ed Youngstrup, a urologist with our Dignity Health Medical Foundation. He will be presenting on Wednesday, June 9th at 12 p.m. on the topic of men's urinary health. We have that topic along with other opportunities available to you at all time for registration at the link I have presented there. Feel free to check it out and register for whatever topics are of interest to you. Now, let me introduce you to our speaker today. Dr. Rahul Shah graduated from medical school at KJ Samaya Medical College in Mumbai, India. Dr. Shah came stateside for his internal medicine internship and residency in neurology at UTMB in Galveston, Texas. He then went on to complete a fellowship in neurocritical care at Memorial Hermann Hospital in Houston through UTHSC. Upon completion of this training, Dr. Shah helped Bakersfield Memorial Hospital launch the first dedicated neurocritical care unit in the area, serving as co-director and advancing the level of care for patients across the county. Board certified in both neurology and neurocritical care, Dr. Shah has collaborated with hospital administration and nursing to improve protocols and treatment options for patients with acute neurological needs. And with that, I will turn it over to Dr. Shah for his presentation.
Hey guys, thank you for having me here. Pleasure, and hopefully with the presentation, I can share some important and good information for the community. Thank you, Amanda, for the kind words. With that, let me start my presentation. And so, obviously, I'm going to focus my presentation primarily on stroke, and then I'm sure with the pandemic that we've all been facing, and with the crazy year and a half that we all have had, where COVID's taken center stage for most of us, we've heard about the incidence of strokes. All of us have heard about, random young patients developing strokes with COVID or other neurological conditions. And I'm going to shed some light on that and what we can do. Is the treatment any different or not, and so on and so forth. And hopefully it just, is a little educational for everybody, but more importantly, it creates a good amount of awareness to the point where if anybody does encounter a family member or a friend having these symptoms, what they can do about it. Just an overview on what stroke is. I always like to talk about this. There's a lot of definitions we can have, but essentially we have our brain cells, and if the brain cells die because of a lack of blood supply to them, either because of a blocked off blood vessel or because a blood vessel ruptured, essentially that's what a stroke is. And when those brain cells die, they result in impairment of function, different kind of functions depending upon the part of the brain that was affected. And that's sort of what we would summarize as what a stroke is. One of the common ways I'd like to describe strokes, and there's two main types of strokes, as you all might have heard it, is ischemic strokes, which is something blocking off a cholesterol plaque or a blockage in one of the blood vessels that cuts off the blood supply, and hence the part of the brain that it was supplying blood to starts dying. And then the other type is a hemorrhagic stroke, which is because of a rupture of a blood vessel. One of the analogies I always use for my patients is think about the brain cells as plants and think about the blood vessels as pipes supplying water to those plants. And when if you suddenly have something that blocks off the water supply in one of those pipes, the plants start dying. And that's essentially what happens in an ischemic stroke. And the other option is if the pipe itself was to bust open, then the plants still die because now there's just the water's being flooding around, but the plants don't get any. That's essentially what happens in a stroke. Brain cells die because they don't get enough blood and oxygen. Again, this is a nice picture demonstration of what the two major types of strokes are. Ischemic strokes, which are far more common, 80%. And as you can see, something blocks off a cholesterol plaque or a blockage, stops the blood flow, and the brain cells start dying. And then the other one is where the blood vessel ruptures, and hence you no longer get blood flow further ahead from that point. This is a nice pictorial demonstration because a lot of us wonder why different people have strokes, but the presentation are so different. And that's because our brain is devised so beautifully to have different parts of the brain control different parts of the body. And this is a nice demonstration of how our body is represented in the brain. And depending on where the brain, the part of the brain that was affected by the stroke, you may have different levels of sort of deficits, so to speak. Risk factors, and we've all heard of these, but I think this is the most important slide, if I may call it, in this presentation, because it is so essential for us to identify what increases our risk of having strokes in general, and what can we eventually do about it. And I'll discuss that later on in the presentation. But the first and foremost is high blood pressure. That's the number one cause for strokes in the world. And second, and very close behind, is diabetes. And then there's cholesterol, obesity, age. Some of the important things that I want to mention are smoking and drug abuse, especially in the young. And this is very significant in our population in Kern County because we see a very high level of substance abuse, especially methamphetamine use and cocaine use. And just the 3 years I've been here, the number of strokes I've seen in 30 and 40-year-old individuals is pretty remarkable. And drugs and substance abuse are a high risk factor for that. Now, we talk about stroke and there's stroke awareness, and you'll probably see a lot of billboards talking about stroke. Why is it so important, right? It's the fifth largest cause of mortality. Now, as grim as that number sounds, and there's 130,000 deaths per year, it is also a cause to celebrate a little bit, just because not too long back, stroke was the third largest cause of death in the country. So that sheds a light on the advancements in treatments and the technological advances and the better medical care that we're offering our people and our patients, which is causing more people to survive strokes. But what it's also doing, and the downside to that, is that we also have a lot more people with long-term disability, and stroke is the number one cause of disability in the US as well as the world. And the numbers are staggering still. 800,000 people per year in the US have a stroke of some kind. About 1 in 3, and why is this? And these, I'll just shed some numbers because I think numbers paint like a very detailed picture of why this is such a big health issue around in the US as well as the world. 1 in 3 US adults has high blood pressure, huge number. And about more than 50% of those don't have it under control or don't have the best treatment for it. And though this talk focuses on stroke, you guys might have picked up on the fact that almost most of the risk factors for stroke are the same as the risk factors for cardiac disease. And those together are probably the biggest sort of killer in the world, essentially. And in today's world, I think with more growing awareness about social, racial equality, and everything, I did want to mention a few things, and I think it sheds a big light on how disparate the medical care and the disease profile is in our community. 50% more likely the African American community to have strokes compared to non-African American patients. Black men are 70% more likely to die from a stroke than Caucasian counterparts. And Black women, African American women, are twice as likely to have a stroke compared to their Caucasian counterparts. And those numbers are startling. And there's some other data over here that again paints a very grim picture. And I think we have evolved and we have a better understanding to where we cannot just dismiss a lot of these numbers to just difference in lifestyle. I think a lot of this also reflects the availability or access to healthcare that a lot of our communities are lacking, especially our minority communities. And I think it basically begs us to make a better sort of attempt at making availability of healthcare more equal to across the board and across our community, because the numbers are literally very startling, almost twice as bad as any other population. Now, what can we do if someone is having a stroke, right? That's the big question. And I think the reason I stress on the word hyperacute management over here is because time is literally the most important factor when somebody is having a stroke. It's not something where we can sit on. So the rapid diagnosis, and this is where a lot of you guys come in, because if somebody's having a stroke out in at home or out in the field, identification of stroke-like symptoms is the most important by bystanders or family members, is the most important factor in making sure that an ambulance is called immediately or 911 is called immediately. And that's where you guys come in, I think, to identify the simple telltale signs of somebody having a neurological dysfunction. And that's what I wouldn't even say stroke, because I don't think we need to, all of us need to diagnose stroke, but just identify that something's wrong and it may relate to something being wrong in the brain and we need to do something about it. And I think that what is that something that we need to do about? Call 911. Essentially, that's all there is to it. And you know, we are lucky because now most communities are having more and more hospitals that are primary stroke centers. Bakersfield Memorial Hospital is a primary stroke center and a 24/7 thrombectomy capable center, and I'll mention that. And these terms are important because research has shown that when patients are taken to primary stroke centers or specialized stroke centers, the outcomes are significantly better and they can get the right sort of treatment that they need. What are those treatments? IV TPA, you all might have heard about the term, the clot busting medication, and that's what this is. If the patient arrives to a center in the right amount of time, then they can get access to this medication, as well as far more advanced endovascular treatment options like mechanical thrombectomy. And I can stress on that later as well. Again, y'all have all heard of the FAST acronym that we all sort of mention and try to create awareness of. And what is it? You know, what I mentioned about identifying when somebody is having symptoms that may reflect them having a stroke. If you see somebody's face drooping, or if you see that there is a weakness in their arm or leg where they can't hold one arm up or one leg up, just the way they can do it with the other arm, or if they're having difficulty with forming words or their speech is appearing very muffled or slurred, those are telltale signs of strokes. And if any of that is visible in somebody with you, time is of essence. Call 911 immediately and make sure that they get to a facility where they can be treated immediately. Now, sort of what are the treatments? Can we do something about, because for years, I think when people had strokes, it seemed like a done deal. They just went to a rehab and they just live with deficits. Well, medicine has advanced and neurology has advanced tremendously over the last couple of decades. And now we have genuine treatments to completely reverse the symptoms of a stroke if the patient arrives to us within the right amount of time. And again, you guys probably might keep hear me just repeating that time caveat, and that's actually very important, because if, as I said, if y'all don't take anything from this presentation, take the fact that yes, time is of essence, and if a patient gets to a facility in the requisite amount of time, we can do something about it. What are those things? First is, if they're eligible, and not everybody is, but if they're eligible and if they're having an ischemic stroke, which is the commoner type, they can get the clot busting medication called IV TPA, or tissue plasminogen activator. And the initial analogy that I gave you about plants, essentially think of this as the drainage that you might add into a blocked pipe, right? That's essentially what this does, and can open up that blockage, hopefully, to where we can save some of those brain cells from dying completely. And we recently had, initially, we could only give this to somebody within 3 hours of their symptoms starting, but now we can even give it up to 4.5 hours in the right settings, and if they meet the right criteria. And as a matter of fact, a lot of strokes do happen at night, and people wake up with stroke-like symptoms. And previously, these patients were dismissed as not being amenable to getting the treatment, and because we didn't know when their symptoms started. But there was a landmark trial recently called the Wake Up trial, and that showed that we can still give the TPA medication in these patients and save a lot. So if, God forbid, you have a family member that has symptoms as soon as they wake up, or still, time is of essence. We don't need to go in too much detail about this, but some of the common ideas that people had about strokes, or misconceptions, if they are on warfarin or other antiplatelet medications or blood thinners, they can never get TPA. That's not true. There's certain caveats to that, but if they don't have any active bleeding, they're still candidates for TPA. If they're pregnant, they cannot get the medication. That's not true either. Actually, in that case, it becomes more imperative that the pregnant female receives the medication, so that her life, as well as the life of her child, could potentially be saved. The only major contraindications to getting this medication is if somebody's actively having major bleeding, or if they had a recent head trauma with a lot of bleeding within the last few months, or they're actively on blood thinning medications and their blood is, and the levels of those medications are fairly high. The second thing that I mentioned, and some of y'all might have noticed when I mentioned initially, after TPA, we now have what we call mechanical thrombectomy. And this has changed the way we take care of stroke patients, and the good outcomes that we can get now over the last decade. So what you can see is basically a very, very minute, this is a quite sort of magnified image of this device. And what we can do is, we can pass through this device through the groin or through the wrist into the blood vessel, pass it all the way into the brain, into the blood vessel of the brain. And that right there is what you can see, a clot being pulled out. And so you can actively pull out the clot. Again, same analogy as before. Think of this as being like the little snake that you pass into the pipe to pull out the blockage. That's essentially what we're doing here. And it's remarkable, because a person who was completely paralyzed and could not speak, you could basically, I have seen patients walk out of ICUs completely intact with zero symptoms that would have been paralyzed for the rest of their life. So again, time is of essence. We can't do this for everybody, and we can't do this once the brain cells are dead. And so always remember to make sure that patients get the best care quickly enough. And again, Memorial Hospital is a 24/7 thrombectomy capable hospital, and we have this treatment available 24/7 for all our patients that may arrive here with a stroke. And to just sort of, I think pictures speak 1,000 words. And I think this, if you can see here, the blood vessel over here, this nice gray lines are blood vessels. And this is the skull over here. You can see no blood going beyond this point where my pointer is. That's because there's a blockage over there. And after one of our specialized endovascular surgeons goes in and uses a device and pulls that clot out, now you can see the blood going in further. So it's remarkable what we can do. And I think this picture itself says you don't need to be a radiologist or a neurologist to see the difference or the change in the blood supply. And you can save very important brain cells by doing this. Again, time is of essence. Typically, the best outcomes are when patients arrive within 6 hours and we can do this procedure. But now, with latest trials, in certain patients, not in all patients again, but in certain patients, we can do this procedure up to 24 hours if the brain cells are still active. Again, the important key is to get them to the right type of hospital in the right amount of time. The other stuff, aspirin, Plavix, you all must have heard of this. This is sort of similar treatment to patients with cardiac conditions as well. And there's, as I mentioned earlier, if the patients are cared for in stroke units or neuro ICUs, like the one we have here in Bakersfield Memorial Hospital, their outcomes are far better. And this is not me trying to talk about the fact, because I'm a neurointensivist, but there's enough research that has shown that when patients are cared for in units that are specialized for neurological care, they do much better. Now, again, coming back to the important topic this last 15 months, the one word that sort of just completely taken over our imagination and our lives to a certain extent, COVID-19, right? Y'all have all heard of like the association of COVID-19 with strokes. You'll have probably heard reports and, social media messages, news agencies talking about strokes. Is it true? And the answer is yes. We obviously are still learning more and more about what this crazy viral disease is doing, but we already know that almost 7 to 8 times increase in the number of strokes with COVID-19 than in the average population. And basically 1 to 6% of patients testing positive with COVID-19 are presenting with strokes. And those are fairly high numbers, especially when you think about the mortality and the morbidity and the disability caused by COVID-19 itself. And then you add on to the fact that it's also causing strokes. You're talking about, immense implications economically, socially, and health-wise. Now, there is obviously a lot of medical factors why this virus is causing clots and strokes. And I won't go into those sort of pathophysiological definitions. But apart from the things that the virus is doing itself, I think there's a lot of sort of common ground. Y'all have all heard that patients with high blood pressure or diabetes or obesity do far worse with COVID-19 than patients who don't have those. And again, those are the same risk factors for stroke and heart disease as well. So that kind of makes sense that we're seeing more of those things, more of those conditions with COVID-19. Also, I think the last 1.5 years, people, there's been lockdowns, people have been staying at home, isolating, some more sedentary life. The extent of activity has gone down. The consumption of alcohol and fast food has increased drastically. Stress levels have increased. People are not following up on their health issues as well, and missing prescription refills, less follow-ups, some of it because of fear of getting out in the public so that they might contract the virus itself, some of it just because of the stress levels and priorities changing. But I always say that your health should always be your number one priority, because without your health, you're not going to be able to do a lot of other things. So what does literature say so far? That the incidence of large strokes and multiple strokes is more with COVID-19. So we're talking about bigger strokes, not the small strokes. I see a lot of patients telling me, oh, I had a mini stroke in the past. COVID-19 is causing large strokes that are leaving people completely debilitated or causing death. Poor outcomes, higher mortality. Patients with COVID-19, even with a previous history of stroke, not even with a new stroke, are 3 times more likely to die. Those are startling numbers, guys. Now, and then the most concerning part that I always mention is that COVID-19 we're looking at it causing strokes in young people without risk factors either. So I know of stories of 30 and 35-year-olds presenting with strokes or large strokes who didn't really have any major risk factors or some minor risk factors. And that is scary because it's changing the age group that we're treating as far as strokes. Um, Now, the most important question is the diagnosis or treatment any different if patients have strokes with COVID? And the answer is no. And that's sort of what you guys need to remember. It's not as if we can't still give these same amazing treatments and therapies to patients with COVID. We have, even in our hospital, and having spoken to my colleagues all over the world, IV TPA is still a medication we can give these patients. Also, they should be catered to in stroke centers, which are capable of taking care of their respiratory condition if they have any, as well as their strokes. And thrombectomy is still life-saving. So if somebody is having stroke symptoms and they are currently COVID positive, it does not mean that there is nothing that we can do for them. We can actually do all these same things and still save their lives. If anything, it's put more significance on rehab facilities just because we're seeing greater number of strokes in younger patients. So I think as a society, we need to focus more on the rehab facilities we have and acute rehabs and everything, and improve the availability of those to get more and more of our population having strokes back on their feet, back to an independence of level of living, if we can. And then again, close follow-ups become extremely, extremely important. Again, as I said, the most important thing is increased awareness, vigilance, more so in the COVID-19 population, and to call 911 immediately if you see anybody having stroke-like symptoms. Most important though, we can talk as much about COVID causing strokes or increased number of strokes in COVID patients and all of that. Prevention is better than cure. And that prevention is the same, be it COVID patients or non-COVID patients for stroke. And what do I mean by this? Control your blood pressure. Go to your doctor, look at your numbers, make sure your blood pressure is well in control. Control your diabetes, improve your diet. Very, very important. We cannot make the excuse of COVID making us, sedentary and, keeping us at home anymore. Control your cholesterol levels. Most importantly, be regular with your health checkups. Weight loss, quit smoking, quit the smoke, doesn't really help. Cut down on the alcohol consumption. Simple things, right, that we know are good for our health irrespective, but have just become so much more important with this pandemic staring us down for the last year and a half. Start exercising. No excuses. I keep hearing people, the gyms have shut down, but that's not an excuse, guys. There's enough we can do at home. There's stuff we can do around our neighborhoods, go for walks, get outdoors. Probably better to get that fresh air anyways. And if you've not already done so, get the vaccine. Everybody asks me, oh, is it safe? I'm not sure if I want to put this in my body. And I commonly ask them, it is far safer than the fried food you're eating. It is far safer than the alcohol you're drinking, and far safer than the cigarettes we all are smoking. So, or, even the polluted air that we're breathing in. So, go get the vaccine. It's the best thing you can do for yourself and for the community as a whole. And it's our only real shot at controlling this pandemic. And the pandemic is real. It's not gone away. You all are hearing about the stories in countries like India, and it's the virus. It's going to find ways to survive. That's what viruses do. They mutate. And so that the virus is not just going to leave the planet suddenly. It's going to always be around, and it's our job to do our duty and do our part in making sure that we are not at risk for the same. And the vaccine at this point is our best bet. Ditch the conspiracy theories. If you have doubts, don't go to social media, guys. I know it's social media has taken over our lives over the last few years, but reach out to legitimate healthcare professionals. There is enough good information out there if you really desire it. enough accurate information out there if you really desire it. You all just need to ask the right people or reach out to the right sources. And cut down the stress, guys. Control the controllables. We can only do so much that we can do, and stop worrying about the stuff that's not in your control. And most importantly, I just had to add this, especially with the world we're living in right now. Share some love, guys. Ditch the negativity. I think COVID-19 has made us realize that we're as much as some of us might want to believe that we're not, we're all the same. We're literally the same people, and we just need to treat each other the way we would want to be treated ourselves. That's a simple message that I would want everybody to take from this. Again, some of the things I say is exercise your brain, exercise your body. That's the best you can do to prevent a lot of diseases, not just COVID, not just strokes, not just heart disease, but in general, just to feel good in life, I think. And this was just a simple slide I put at the end. COVID's causing, apart from strokes, it's causing a lot of other neurological conditions as well. And we don't need to go into this, but it's an incredibly interesting but crazy virus that's doing a lot of presenting in a lot of weird ways that we never believed possible. So we're finding out more and more information, and I'm sure 6 months down the road we'll have even more information about this virus. And that's sort of all I have. Thank you for listening to my presentation, and appreciate you guys, and I'm open to taking questions if y'all have any.
Okay, everyone, thank you for that wonderful presentation, Dr. Shah. It does look like we have a couple of questions in the chat box. So I'm going to go ahead and ask you those now, if that is okay. First question today: what is a TIA, and is it the same as a stroke?
Fantastic question. So, just to keep the presentation sort of simple, I mentioned just the two main important types of stroke, which is ischemic as well as a bleeding type of or hemorrhagic stroke. But TIAs, a lot of y'all must have mentioned or been told, oh, you had a mini stroke or a stroke. A TIA stands for transient ischemic attack. So like the name suggests, transient, where somebody has stroke-like symptoms, but they suddenly improve within a few minutes to a few hours. So somebody who might have stuttering speech or facial droop or weakness in the arm, but it doesn't persist. Now, does that mean that they're scot-free, they can just walk away and don't need any more care? Actually not. Conversely, the likelihood of somebody having a large irreversible stroke within 24 to 48 hours after having a TIA is incredibly high. So if somebody's having a TIA at home and their symptoms improve, you still need to call 911, you still need to come to the hospital, and you still need to be monitored and watched out, and your risk factors taken into consideration.
Excellent, thank you. Next question: are COVID strokes more severe or more damaging than strokes in the general population?
Yes, I don't think COVID strokes per se, but COVID is causing out of the percentage of strokes COVID is causing, a lot more are larger strokes, if that makes sense. So yes, it can still cause some smaller strokes, but we are seeing a greater incidence of larger strokes, more debilitating, more disabling strokes with COVID than we would otherwise see.
Excellent. We have here at the hospital and across the healthcare system observed that with the threat of COVID in the community, folks were avoiding or delaying preventative exams and tests. Do you feel it is safe now for people to resume those in order to catch problems early?
Absolutely. I think, and that is why one of the things I mentioned is go out and get your health checkups. It is safe. Doctors' offices are taking enough precautions and preventive measures to make sure that there's social distancing. A lot of the things we are doing with COVID, we continue doing. And we've already seen the reason right now that the US is doing so well with regards to the numbers is simple things, right? People have become more conscientious of social distancing. masks, and most importantly, the vaccination. So if you're vaccinated, your risk is far lesser already to contract a severe disease. Vaccinations do not completely take away your risk of having COVID, but it decreases drastically your risk of having severe disease or dying from it. So you're a lot safer in general. I think most hospitals and medical facilities are requesting you to wear masks, so it is fairly safe. And I think at this point, you do need to go for that health checkup if you have been avoiding it for the last year.
Thank you very much. Do you feel that a test measuring your cholesterol levels is a good measure of your risk for stroke?
One of them. As I said, high cholesterol is one of the risk factors for strokes. So if you have a good cholesterol level, does not mean, but if you're smoking and have high blood pressure, does not mean that you do not have risk for strokes, right? So I think it's one of the many things that we need to look at, or your primary care physician or your cardiologist needs to look at. And if the numbers are high, then we need to start doing something about it. What are those things? Medications, but more importantly, call me old school, but maybe weight loss and exercising is a far better fix for most of those risk factors, to be very honest.
Makes sense. Next question. The listener says, I know prevention is our #1 goal. If someone has had a stroke in the past and they haven't been told what caused the stroke, what types of evaluations do they need to have once they leave the hospital?
That very good question, actually, and we do see a lot of this. Patients are just sent off saying, oh, you had a stroke in the past, or you had a stroke, and then they do not really know why, and they do not know where to start off with preventing future strokes. And the reason this is significant is because once you had a stroke, your risk for having a second stroke increases exponentially. Far greater than somebody who has not had a stroke in the past. So what are the tests you can do? You can have your heart evaluated, because a lot of blood clots can originate in the heart, or you may have a condition called atrial fibrillation, which is basically an abnormal rhythm in the heart and increases your likelihood of having strokes significantly. And you may need to be on a blood thinning medication. Again, the other tests that you can do are look at your blood vessels in your neck if you need to. Just your cholesterol levels, your blood pressure checkups, your blood sugar levels if you have diabetes, and if you don't have diabetes or don't know whether you have diabetes, to check if you actually do. And people will be surprised as to how many people are not even aware of the fact that they had high blood pressure or diabetes until they actually had a big stroke, and that's when they find out that they have had these conditions but never had treatment for the same.
The second part of that question, I think you've already answered it, but it states, is cardiology a reasonable consult in regards to preventing a secondary stroke? It sounds like, based upon what you just explained, that's absolutely a reasonable consult.
Absolutely. Again, each patient is different, and the cause of strokes in each patient the causes are different. But in a lot of patients, I think we would recommend their heart to be looked at, just if not for any other reason, for the same reason that strokes and heart disease have so many similar overlapping factors. So a lot of patients that have had stroke or have high risk for stroke may have underlying heart disease as well.
Okay, that makes sense. That is the end of our Q&A session right now. I am going to let my colleague Shah take over at this point, the part that some of you have eagerly been waiting for, the raffle prize for our participants.
All right. Thank you. I want to make sure everybody can hear me. We're going to do the raffle now. Thank you all for joining, and thank you to the doctor. That was great information. Our raffle winner is, I can see Brian. If you can stay on the line, it just says Brian there. If you can stay on this after we end the call, we want to get your contact information. But you have won a $50 Target gift card. So again, we appreciate everyone's participation. And from all of us at Dignity Health and a providers organization, thank you so much for joining us. If you have further questions, please reach out to the Bakersfield Memorial Hospital Neuroscience Institute at the numbers that were shown on the screen. This presentation has also been recorded and will be sent to each of you who have registered. We have your email address, so please feel free to share with friends and family. This concludes our event. Thank you all. And again, a reminder, Brian, please stay on this call so we can get your information. Thank you again. Thank you to the doctor, and have a great afternoon.